Anemia is a common blood disorder. It affects millions worldwide. Anemia occurs when you don't have enough healthy red blood cells. These cells are vital for carrying oxygen throughout your body. The World Health Organization, or WHO, defines anemia based on hemoglobin levels. For men, it's less than 13 grams per deciliter. For women, it's less than 12 grams per deciliter. Anemia can range from mild to severe. It can be temporary or long-lasting. Left untreated, anemia can lead to serious health problems. These problems include fatigue, heart problems, and developmental delays. Recognizing the signs and seeking timely treatment are crucial for managing anemia effectively. Anemia isn't a single disease, it's a condition with various underlying causes. Understanding these causes is essential for proper diagnosis and treatment. In the following sections, we'll delve into the different types of anemia, their causes, symptoms, and available treatment options. There are many types of anemia, each with unique characteristics. Understanding the different types is crucial for identifying the root cause and determining the most effective treatment approach. One major category is hypoproliferative anemia, resulting from inadequate red blood cell production. Iron deficiency anemia, the most common type, occurs when the body lacks sufficient iron to produce hemoglobin. Megaloblastic anemia arises from deficiencies in vitamin B12 or folate, essential for DNA synthesis in red blood cells. Aplastic anemia, a rare but serious condition, involves the bone marrow failing to produce enough blood cells, including red blood cells. Another category is hemorrhagic anemia, caused by blood loss. This can result from acute or chronic bleeding, such as heavy menstrual periods, gastrointestinal bleeding, or trauma. Finally, hemolytic anemia involves the premature destruction of red blood cells. This can be due to inherited disorders like sickle cell anemia or thalassemia. It can also be triggered by autoimmune conditions, infections, or certain medications. Anemia often develops gradually and symptoms may be subtle initially. As the condition progresses, symptoms become more noticeable and can significantly impact daily life. Common symptoms of anemia include fatigue, weakness, and shortness of breath. Individuals may experience pale skin, especially noticeable in the palms, gums, and nail beds. Other symptoms include dizziness, headaches, cold hands and feet, and chest pain, particularly during physical activity. Specific signs can help distinguish between different types of anemia. For instance, iron deficiency anemia may cause pica, an unusual craving for non-nutritive substances like ice or dirt. Vitamin B12 deficiency can lead to neurological symptoms, including tingling, numbness, and difficulty walking. It's important to note that these symptoms can also indicate other health conditions. Therefore, it's crucial to consult a healthcare professional for an accurate diagnosis if you experience any of these symptoms. Diagnosing anemia involves a combination of medical history evaluation, physical examination, and laboratory tests. A complete blood count, or CBC, is the primary test used to detect anemia. It measures various parameters, including hemoglobin, hematocrit, and red blood cell indices. Further tests such as iron studies, vitamin B12 levels, folate levels, and a peripheral blood smear may be conducted to determine the specific type of anemia. Additional investigations, such as bone marrow aspiration or biopsy, may be necessary in some cases. Treatment for anemia varies depending on the underlying cause, severity, and individual patient factors. Iron deficiency anemia is typically treated with iron supplements and dietary modifications to increase iron intake. Vitamin B12 deficiency is managed with vitamin B12 supplements, either oral or injectable. Hemorrhagic anemia requires addressing the source of bleeding. Treatment may involve medications, surgery, or blood transfusions. Management of hemolytic anemia depends on the cause. Options include medications, blood transfusions, or in severe cases, bone marrow transplantation. Early diagnosis and appropriate treatment are crucial to prevent complications from anemia. Untreated anemia can lead to fatigue, impaired cognitive function, and delayed growth and development in children. In severe cases, it can contribute to heart problems, pregnancy complications, and increased susceptibility to infections.